Hello friends, welcome you in Research News. In this video, we are going to see how to conduct a study that has large number of animals. So, this kind of study, how we are conducting in lab, where number of person is less or manpower is less in your lab. So, how to conduct that type of study that we are going to see. What happens when the student are conducting that kind of study? They have less manpower, so that time they have to suffer how to conduct, or they are conducting study and they have to face many problems while conducting this study, because in single day induction of diabetes in large number of animals is quite difficult. That time, what strategies you should adopt, that we are going to see in this video. Now, after allocation of the animals in the groups, we have first task to induce the diabetes in the all animals excluding normal control. So this is the first task we are going to do while we have allocation of the animals in the groups. So after that, we have to plan, we have to schedule what time we have, what activities we have to do. You can see here we have designed the schedule. In that, we have divided this schedule as per date, as per day, weeks and stages. So according to these stages, we can easily calculate the timing, how much timing we needed for particular activities. And according to that, we have divided the our activities in set wise, and every day, each day we have to follow one set. Accordingly, very second day we have to do second set. Like that we have to follow. So all five set we have to do. So this is how we can design our diet study schedule. Remember one more thing, the dividing the all animals in set wise not such easy. You have to prepare a table. In that group wise you have to add equal number of animals in each set, and one by one you have to add the animals in the table, so that you can easily make the set wise arrangement. Otherwise it is sometimes little tricky. Here you can find equal number of animals are there in each set. Now our first step is to induce the animals with diabetes. So for that we have to exclude from the all animals the normal control, so that that group we have to separate from this all animals group, and remaining all animals we have to induce diabetes. So that part we have to keep in mind because it is necessary, otherwise you will induce same day all animals. On day 1 you have to work for set 1 only. There is no need to touch any other set that day. Here you can see we have 90 animals, and each set having 18 animals. On day 1 we will induce 18 animals only. Now before set wide division we have to randomize the animals, and that randomization procedure I have given in my other video. You can see that. I will provide you the link in that description, and that we have to follow the procedure. And then all our experiment schedule is divided in some parts. You can see here it is divided stages wise, and in that stages first is induction procedure. For 5 days we are going to do induction, STZ induction. Then there is a phase of pre-dosing. Now we will move as per schedule Here we have completed randomization and then the STZ induction, and day 1 we will induce to 18 animals the STZ, and then day 2, on day 2, day 3, day 4, and very next day, day 5, we will complete the induction procedure to all 18 animals. Likewise, for all 90 animals, we will induce, excluding normal control. After STZ induction, there is we have to take a body weight before induction. That is norm, because without body weight we cannot calculate the STZ amount. So that is obvious, that you have to keep in your mind. And same day we have to do visual. We have to see their blood glucose level after induction. 6 hours later we have to check that what is the visual level. And then lastly, on day 7 we have to confirm that our animals that we have induced diabetes, it came in range of diabetes or not. The blood glucose level is above 250 or 300 mg per dial or not. After induction, after check of 6th hour visual level, we have to again check the visual level at 24 hours, because that time we are mainly confirm that the animals are coming, animals are induced or not. So that we have to confirm. What happens, sometimes animals are not induced, so those animals we have to mark, and again we have to reinduce those animals with same amount of STZ in very next set, with the very next set, so that those animals we can again we have to check that they are coming in diabetic range or not. Sometimes some animals are resistance to STZ, they are not giving response. So we have to remove those animals from the study and incorporate some other animals in our study, and then we have to go further. You have seen that in week 1 we have completed the induction work, and second week we have checked the VGA level for all set to confirm they are coming in diabetic condition or not. And simultaneously we checked what is their body weight during first week and during week second. Now from day 6 we have entered in second stage, pre-dosing stage. You can see in pre-dosing stage, mainly from day 6 to week 7, we have only maintained the glucose level, and we have taken BCL level weekly and body weight weekly. During pre-dosing stages, while we are checking blood glucose level, we have to check that the glucose level is rising above 500 or not. If it is rising above 500, we have to maintain that blood glucose level in range of 300 to 500 only, because and for that we have to give insulin to the animals. Otherwise what happened, the animal will die, because they, if the blood glucose level is over the limit, means more than 500 and up to 600, above 600, because we cannot check that is above 600 or not. So in that range, if animals are surviving, they may die anytime. So to overcome this problem, we have to provide insulin 1 unit dose, at least weekly once, to those animals that are above 500 mg per dial glucose level. At 8th week, or moreover in pre-dosing stage, now we have to check the diet screening test. You wanna know what is the diet screening test? Diet screening test is a condition when the animal, because we are inducing diabetes to animals, if they are induced and after inducing they are producing penile erection or not with diabetes, that we are checking in this test. So for that we have to give all animals a apomorphine, and after giving apomorphine in 30 minutes in specific condition in black box, the animal has to give the response, means they have to show the penile erection if they are non-diabetic, or if they have not induced, they are giving response to penile erection. If they are diabetic, they are not giving response, or diabetic, or they have penile dysfunction. So sometimes what happens, some animals are diabetic but they are giving response. So that type of animals we have to remove from the experiment. Only the animals, those who are not giving response, that we have to select and go for further study. Keep in mind one more thing: before animals or entering animals into the black box, they should be acclimatized for 10 minutes. Each animal should be acclimatized for 10 minutes, so it will be easy to get the response. And next, the black box should be fabricated properly so that the response can be easily observed to you. So these points are important during the diet study. Now moving to next stage. At this stage, randomization of animals will be difficult because due to the mortality of animals in diabetes, the number of animals per group will be reduced. And next point, due to the diet screening, those giving response after apomorphine injection, those animals we have to remove. So due to that, the number of animals are less in all group. For that, we have to manage. So in this condition, we have to do the randomization. We can do that by blood glucose level or by body weight. By doing randomization by blood glucose level, it may be difficult because the the fluctuation of blood glucose level is too high at that time. And next, again, if you want to do blood based on blood glucose level randomization, you can do 8-week average, and you can take 8-week average of blood glucose level and then do the randomization. Otherwise, body weight is according to the body weight randomization will be okay. After randomization, next step is to check at least 4 week body weight and BCL level, and that should be in set wise manner. So suppose you are giving dose now, because next step is dosing stage. So in that we have to give the doses daily basis, and after the dosing 4 to 6 hour gap is necessary, because while we are dosing, there may be some effect in drug. So after dosing, it may be easy to know that what is the blood glucose level in that after dosing, if drug has some effect or not, that we can check in that duration by giving some times for reducing the blood glucose level, because some drug gradually reducing the blood glucose level. So to judging the effect of drug, that time it is quite difficult. So giving gap of 4 to 6 hours is rational at this point of time. And after this, next step is to check body weight, and that should be set wise in means daily basis. The blood glucose level check and body weight, the set wise manner you have to take every day, because per day you are dosing, same day you have to check same set blood glucose level and body weight. So that type of routine you have to maintain, and in every week you have to see that like here 5 set, and that you have to complete BCL level and body weight set wise. So it will be blood glucose level check for each animal. That type of schedule you have to maintain on daily basis. So weekly once there will be evaluation will be done for blood glucose level and body weight. So this is how you have to maintain the routine in dosing stage. And next, after completion of the 4 week like this, you have to again go for the diet screening, because it is a diabetic study. During that, there is the more chances of mortality of animals, and and that is or it is obvious. So you have to care for that, and at least after 4 week, you have to do one diet screening. So it may be means save some data. What is the effect? It may check some effect of the drug. As per the model, it is 8 week model, but in between, if you are checking that you are doing diet screening, it will help to retain some result of the drug. Otherwise, the mortality and chances of you have to stop the experiment, because there may be sometimes animal may reduce, the number may reduce, and that is not giving the significant result, mean quality result. So you have to stop that experiment. So in between, you have to care, and consciously take decision to evaluate a diet screening experiment in between. Now in this experiment, we have to first acclimatize animals for 10 minutes. After acclimatization for 10 minutes, animal has to give the doses of apomorphine. The apomorphine dose should be subcutaneous, and it should be 100 mg per kg. That may vary as per the lab condition and the animal physical condition that time. So that we have to see lab environmental condition. And next point is, after giving dose, immediately we have to put the animals into the black box, and in that black box we have to observe the penile erection for 30 minutes. In that duration, the penile will bulge out from the body surface area, and you can see from side also, and you can see, but seeing in black box, it will below the black box. You have to keep the camera. By that, you can capture the rotating out the penile, and you can capture the penile erection by that way. Moreover, in this experiment, by this way, you can capture in one time 2 to 4 animals. So, likewise, you have to see that how much animals you can capture their penile erection recording for 1 hour, so that that way you can manage your set, you can design your set. So in this condition, we have to see how many animals we can induce in one day, and how many animals diet screening we can do in one day. Accordingly, we have to arrange the set. So friends, how was the video? Please do comment. And this is the part one, how to design an animal study schematically in test set voice and diabetes-induced erectile dysfunction. If you want part 2, please do comment. I will definitely share those remaining part. And lastly, I want to say, please share my videos so that I will get some confidence to make this type of videos, because it very time consume, and I am getting confident only then if you are sharing my video. And please do subscribe, and please share to your friends so that I will get the confidence and share more videos like this. Thank you for watching Research Need. Thank you very much.